Yeah, the egos are hard because I think our field, in the ER, in the field, we attract people with bigger egos, people that are, want to get things done themselves, do things themselves. And we just deal with a lot of egos. I remember one call I ran. It was we were responding to an urgent care for a kid that was short of breath. And, so we're all a little bit more amped. It's a kid, they're in some respiratory distress. And I listened to the fire department give me a report. And then I went in to examine the patient, listen to their lung sounds, and they really got offended that I re-examined the patient. And so, I think I even had to have a sit down about this because I went in and examined the patient and I thought I had done everything right. Like I listened to them give a report. I'm like, okay, yeah, totally get it. And then they were just so offended that I kind of walked past them to examine the patient. But I'm like, this is what you expect of the ER provider to do. You listen to a report and then they're going to examine the patient and make sure they concur with what you think is going on and see if there's any other treatments that are warranted. But sometimes it's just a poor understanding of the succession of care. You have to do your own exam, just like cops when they transfer a prisoner over. Everybody's making sure they're cuffed and they've been patted down, because not that you don't trust whoever had the prisoner before you, but you're verifying for your own liability that things are getting done the right way and not just assuming everything's done. But
less chance for mistakes to happen.
Yeah, exactly.
And we're in emergency medicine. We've seen people switch on the flip of a dime.
Mm-hmm.
Like 1 second, they're just slight wheezing, and the next second they're diminished in all lung fills and tripoding. So,
yeah, serial exams are not that big of a deal and shouldn't affect people's egos.